Everybody ready? Yeah. I'm ready. All right, so we're talking about nutrition today. So nutrition and health in the era of COVID-19. I'm Trey Tate, if you don't know that. I work on the fit side as a motion specialist here. And I'm not an expert on nutrition, so I'm definitely knowledgeable, and I try to use as much scientific literature for this talk. So here we go. All right, where are we now? So obesity and being overweight are at epidemic proportions in the US population. So before we had the pandemic of COVID-19 even coming here, we were already in an epidemic of obesity and being overweight. This is from the US Surgeon General, Richard Carmona, in 2004. As we look to the future and where childhood obesity will be in 20 years, is every bit as threatening to us as the terrorist threat we face today, is a threat from within. It has been said that ours is the first generation whose parents will bury their children due to childhood obesity and its related chronic diseases. Obesity-related medical care costs are in the billions, so this is a very expensive thing for us as a society. You can read it there between 3.3 billion to 6.38 billion with obesity-related absenteeism. Obesity has implications for our armed forces. We had many people that weren't eligible just to even go through basic training due to their BMI. And currently in the United States, over 70% of our population is obese or overweight, and 40% of those people are considered obese. This is a large amount of our population that just aren't healthy. So this one kind of saddened me. So this is actual childhood obesity for children and adolescents ages 2 to 19 years. This starts all the way from 1963, goes all the way up to 2016. I mean, even 2 to 5-year-olds have gone up in being obese. So overall, this has just been the trend. So just kind of showing you the trends and society, all that kind of stuff. All right, so health consequences for people who are obese. All causes of death increases the risk of hypertension, dyslipidemia, which is high lipids in your blood, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea, some cancers, endometrial, breast, colon, kidney, gallbladder, and liver, lower quality of life, mental illness such as clinical depression, anxiety, and other mental disorders, body pain and difficulty with physical functioning. I'm sure you guys are aware of that. And most importantly, severe illness from COVID-19, and it actually gives you a lower vaccine efficacy. If you are obese and you have a vaccine, it's harder for your body to build up antibodies. So I'm just trying to show you the perfect storm that has been brewing. All right, so continuing on with this, COVID-19 deaths and comorbidities. So this was done in April in the Journal of American Medical Association. And more than most people, this was in the New York City area. They studied 5,700 patients that were hospitalized with COVID-19. 88% of people came in with more than one comorbidity. Ranked, we had hypertension, obesity, diabetes, morbid obesity, coronary artery disease, and asthma. Most of these are lifestyle-related comorbidities. And of course, obesity intensifies this. Only about 6% of people had no comorbidities that were hospitalized here. And that matches what the CDC has been saying. For 6% of deaths, COVID-19 was the only cause mentioned. For deaths with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or causes per death. And this correlates well with that. All right, so perfect storm, explain that. So let's get into the nutrition and how we can manage that. So DIETA, the Greek word for diet is dieta, and it means way of life. So when we're thinking of diet, I don't want you to think about restrictions. This is a lifestyle. You are what you eat. Cells are made with the nutrients from food. So if whatever you guys are eating right now, your cells are going to be made from that. So think about that next time you choose your food. All right, continuing. Evolutionary biology. So imagine the first Homo sapiens that walked on the African savannas. We would crave high caloric foods because they would give us the most energy for the amount of work or output that we have to do. So biologically, we crave high caloric foods. Fast forward to now, we have the same body, but we're in this environment now that is chock full of highly hyperpalatable foods, fat, sugars, and salts. And so we have scientists that are hijacking our biology to try to sell us food that we don't necessarily need. And in addition, man no longer has to expend calories to obtain calories. So this is another part of that equation. We're in this environment where there's food everywhere, and we can just go through a drive-through, do our order, get your food, and you're on your way. You don't have to expend a single calorie. And as well, evolutionary, we are attracted to sweet, sugary foods because it was an indication that it had glucose and that it was safe to eat. So, all right, fat cells never decrease in number. So this is why we don't want to get overweight in the first place, because it actually makes it harder to keep the weight off once you get to that certain set level. So a decrease in body weight only changes the fat cell size, they shrink. But if you are increasing in body weight, it can cause an elevation in both fat cell size and in the number of those cells. So essentially, say you're me, I just started eating beyond what I'm burning off. Those fat cells will store that fat, but eventually they reach a critical mass where they'll split because they can't hold that amount of fat anymore. So that one fat cell is now two fat cells. And those two fat cells can keep on taking in the fat. So then if you lose that weight after you've gained all that, those cells will just shrink in size. So, I mean, these aren't the same cells. They're always turning over. Of course, you're making the new fat cells, but the amount of fat cells will not shrink. So unless you're doing liposuction, you're going to have more fat cells. So if you gain a lot of weight, it's going to be easier for you to gain weight again. All right, macronutrients. We all know macronutrients. We got our protein, carbs, and fat. Protein, you got 1 gram equals 4 calories. Carbs, 1 gram equals 4 calories. And fat, 1 gram equals 9 calories. Protein, we all know that for building muscle. It's the most effective macronutrient for providing a satiated feeling. It fills us up. Usually it's not crazy amount of calories. Carbohydrates, those are the sugars, starches, and fibers found in fruits, grains, and veggies. They provide the body with energy to support bodily function and physical activity. Our brain also likes to run off glucose, which can come from your carbohydrates. Vegetables are part of this too. They can be low in calories, but high in fiber. And so eat a lot of protein, eat a lot of veggies. They'll be very filling, but not so high on the calories. And then, of course, fat. It's the highest in caloric density of the macros, so we could use that to our advantage or disadvantage, depending on how you want to look at it. And, of course, we need fat. Fat is required, so don't avoid it. All right, micronutrients. So this is what I'm always thinking about when I'm eating food is the micronutrients. What is that food going to give me as far as micronutrients go? So that's the vitamins and minerals. They're vital to healthy development, disease prevention, and well-being. Even though we need just a small amount of them, we can't produce it in our body. So we do need to intake it from our diet. Deficiencies with micronutrients have devastating consequences. At least half of children worldwide younger than 5 years of age suffer from a vitamin and mineral deficiency. And that's even here in America, just because of the diet that we're eating. Processed foods are usually void of the micronutrients, but they're usually high in the sugar and fat. And then also vitamin D has been associated. There has been a clear association between vitamin D deficiency and the likelihood of becoming infected with COVID-19. So I thought that was an interesting thing to kind of throw in there. All right, individualization is the key to success in weight management. And this is whether you're trying to gain weight or lose weight. I threw in a core value. Recognize that every body and every mind has its own unique potential. Boom, I did it. Okay. But, you know, we're all different. So what works for me might not work for you. What works for Sally might not work for Sandy. So here we go. Success begins by first recording a food diary to measure the amount and type of foods consumed. What gets measured gets managed. I'm sure you've heard that before. Determine the number of calories needed in a 24-hour period. If you did the calculator before this, that would have given you that idea. Develop a simple meal plan from there, and then select meals using the plate method, which is the government's USDA, or the precision nutrition portion sizes, which I sent out as well. And I really like their whole model. It just really simplifies everything. I did take a course for this on MedBridge, weight management and nutrition by JoJo Danton, and it was just, it had outdated information in my opinion, like she was recommending margarine for certain things, and it was very numbers based. I can see why a lot of people get confused when it comes to diet and that sort of thing, because it just seemed like it was very detached from the food itself. So we'll be focusing more on the precision nutrition, but I just wanted to throw that in there. And then ultimately, to lose weight, we must create a calorie deficit. So you got to burn more calories than you consume. And that's with any diet. If it's keto, if you're doing intermittent fasting, if you're doing Atkins, whatever, in the end, you're creating a calorie deficit if you're trying to lose weight. All right. So this is the USDA. This is our government right here. This is the plate method, which, you know, visually, I think it's kind of cool. You know, if you have a plate, you can kind of picture out what you need. So a quarter of the plate would be your healthy protein. A quarter of the plate would be your whole grains. And then the other half, they got veggies and fruits, or you can just imagine all veggies or mushrooms or whatever. And of course, they add in the healthy oils, and they're telling you to drink mostly water. And they give you some examples here of each one. It's okay. It's way better than the pyramid, but it's okay. And I also downloaded the app that comes with this MyPlate. It's terrible. It's really bad. Okay. Anyway, so precision nutrition. I think they've done an amazing job with portion sizes here and just trying to, you know, make it easy, because we all got hands for the most part. And so here we go. So we got your protein, veggies, carbs, and fat. One portion of protein is the size of your palm, so about a hockey puck, boom, and the thickness. Veggies, it's your fist. Carbs, it's a handful of the palm, and a fat, one serving of fat is your thumb. All right. So this was, I actually took this from the course that I took. It's a pretty basic, it'll give you a basic number. It's not as accurate as the precision nutrition, but to get a quick number, it works. So for this, you would take your activity, your actual body weight, multiply it times your activity level, which they have here, depending on who you are. And then if you're trying to lose weight, if you want to lose about 1 pound a week, subtract 500. If you want to lose about 2 pounds a week, subtract 1,000, and that equals how many calories you would take per day. And you could also use the same equation if you want to gain weight as well. All right, so in that example that we just gave, say, I think it says 200 behind here. So say you're 200 pounds, you're currently obese, so you do 200 times 10. That would give you 2,000 calories. So that's how many calories you would have to eat to just maintain that current weight you're at. Let's say you want to lose 1 pound a week. So you would subtract 500 from that 2,000, and you get 1,500 calories. So if you want to lose 1 pound a week and you weigh 200 pounds and you're not very active, 1,500 calories a day will get you there. And just for comparison, my calories came between 1,995 and 2,660 per day, depending if I was doing times 13 or 15 right there. So let's go with the 2,600 number there, and we'll see it on the next slide. All right, so I did the precision nutrition. Hopefully you guys did that ahead of time too, so this kind of gives you a better idea. So their calories, slightly more for me. They gave me around 2,700 calories. Cool, okay. So, you know, I put in my stuff. I said I did paleo. But what I like about them is they take in your age, they take in your current weight, they take in what type of eating style you like, if you're vegetarian or paleo or whatever. They give you your macros, and then they give you your calories that you try to shoot for. But this is what's really awesome, is they actually tell you how many serving size according to your hand that you would need to eat. So for me, if I'm eating 3 meals a day, I would do 4 palm-sized portions, which would mean for each meal, I only need 1 to 2 of those portions, and so on and so forth. So I think this is a real easy thing that we can give to all of our clients. You just give them the link to the calculator, and then boom, they got something that they can follow. All right, a big part of this too is food journaling. What gets measured gets managed. Also, you know, food can be emotional for us too. So if we can figure out what triggers certain behaviors, maybe we can stop that negative behavior from even occurring. So this is also Precision Nutrition. Their website's awesome. So for instance, you know, you can get this for free on their website. So they said what they ate and then kind of realize how they felt afterwards. So this is one part of the equation. So it's trying to build intuitive eating. So this person ate whole wheat bagel and cream cheese and a glass of milk at 8 a.m. And then they noticed a stuffy nose and headache about half hour later, stomach a bit rumbly. So maybe they're eating something that their body doesn't necessarily agree with. I actually did a 24-hour fast on Saturday, just because I hadn't done a fast like that in a while, and I wanted to be up to date with some of the stuff I was talking about. And I broke my fast, and I had potatoes in it. And I kind of, as soon as I was eating the potato, my body was kind of not agreeing with it. Like I got stomach ache, I got real low energy. So maybe in the coming weeks, I might phase that out and just see how I feel about that. So another type of journal with this, like I said, the feels, how you feeling? So, you know, maybe you're depressed, maybe you've had a very stressful day, and maybe you just start eating cookies or whatever. But what's important is that you write that down and you can kind of see, oh, this behavior brought about this behavior. So another awesome tool in our belt. All right, liquids. Calories from liquids can sneak up on you and are completely unnecessary. So don't drink your calories. Water, water, water. Water is all you really need. Anything beyond that is a blessing. So with water, if you get bored with it, you can drink something like LaCroix, which is flavored sparkling water, or mineral water, such as Topo Chico, Pellegrino. You get minerals with the actual mineral waters. The carbonation is satisfying, it's filling. And another example could be spritzing your water with lemon or cucumber to give it more flavor. Of course, we got coffee and tea. Awesome. If you add, you know, milk or sugar, then we're talking a different ballgame, but straight black coffee and straight tea, 0 calories, and the caffeine can also provide an appetite suppressing effect. Alcohol is toxic to the body and contains 7 calories per gram. So if you're drinking alcohol, you're drinking calories. Of course, go for it if you want to. I'm not going to stop you. We got to enjoy life too, right? All right, and then I threw in kombucha and water kefir may provide beneficial microbes for the gut and provide filling and satisfying carbonation. I'm a big fan of kombucha. A lot of the health benefits that are touted are not backed by science, but nonetheless, it's a way to get something that's kind of similar to soda as far as satisfaction, but you're not getting all those calories, and you're still getting some vitamins and minerals from that. So that's cool. If you guys need a SCOBY and want to make your own kombucha, I got them. All right, added sugar. It's addictive. It activates the opiate receptors. It's prevalent, available, and socially acceptable. Sweet foods. Sweet foods are often processed and tasty. We digest and absorb the energy really quickly. And then you're craving stuff again. They overstimulate the reward pleasure centers in our brain. It doesn't add a lot of nutrient value. It doesn't usually have vitamins and minerals and all the phytonutrients associated with it, unless you're eating fruit. But we're talking about added sugar. And most of these foods usually will be, if they're low in fat, they usually bump up the sugar. And it can be an ingredient multiple times in processed food, but under different names. So like sucrose and high fructose corn syrup and all that are different forms of added sugar. All right, let's see how this next thing goes. All right, so sugar versus cocaine. So you've heard it compared as far as its addictive properties, but I want you to kind of think of this in a certain way of how once we extract the sugar and start adding that pure sugar to things, that's when we start getting issues. So most mainstream sugar is made from sugarcane or sugar beet. So we got veggies over here, grasses. So for comparison, we got coca leaf and cocaine. So the coca leaf has been chewed and brewed for tea traditionally for centuries among its indigenous people and does not create any harm and actually has beneficial health to humans. It's a mild stimulant that suppresses hunger, thirst, pain, and fatigue, and it helps overcome altitude sickness. So people can do this and they're totally okay. Once it gets extracted and we have this pure form, that's when we start having these health benefits. So in a way, I'm trying to compare whole food versus processed food. So up top, you know, you got your fruits and your veggies. That's the whole food way you should be getting your sugar if you do want to get your sugar. And then here we kind of have our processed food with all the added sugar. So I don't know if that's sick. It makes sense in my brain. Hopefully it makes sense in your brain. All right, food labels and ingredients. This is an old picture, but it was kind of one of the first things where I was like, whoa. So I was having pancakes. I had finished some maple syrup, and I had some Aunt Jemima still hanging around. So I went to put that on. So on the right, we got our pure maple syrup. A lot of sugar, but it's also packaged with calcium and iron. It actually has micronutrients in it. And on the right, we got something that the food companies are trying to mimic with this, and you can see by the ingredients there, a bunch of stuff there. Either way, it's just important whenever you're getting something, just check out the ingredients and just see what's in it. I think you'll be surprised. I mean, even stuff like Morton salt will have an anti-caking agent added to it. And you're like, well, why is that there? I just want my salt. So just little simple things like that. Just always check the ingredients. Just know what you're putting in your body. All right, time-restricted eating, also known as intermittent fasting to some people. So intermittent fasting, that would be a 16-hour fast with an 8-hour eating window. I kind of prescribe to this more or less. You can change up how you do your eating. And this is just a tool. So if you're fasting for 16 hours and then you just start eating McDonald's and Cinnabons, you're not doing yourself any benefit. What I find beneficial about that window is, you know, there's only so much food you can hold in your stomach at one point. So it can kind of restrict how much calories you're taking in. And there's definitely some benefits. This is a lot of emerging science with this, but it can improve metabolism, lower blood sugar and insulin sensitivity. It can lessen inflammation. So if somebody has arthritis, that might be a good thing for them. It may improve lifespan, lower cancer risk. Another thing with this is that discipline breeds discipline. It takes discipline not to eat. It's also a blessing to be in a country where, you know, food is available everywhere. So I just want to add that. And it's okay to feel hungry. Like if you have that hunger pain, it's okay to have that feeling and to just keep going forward. Autophagy might start happening, which means self-eating. That's where your cells digest and remove old and dysfunctional proteins. So that's always good. And then after a certain amount of time, your body switches from glucose to ketone-based energy. There's benefits to that as well. And it was kind of hard to find how many hours it takes to actually get the benefits of fasting. If you're active, because exercise also brings about a lot of these benefits, it might take 16 to 20 hours to get some of these. And if you're inactive and overweight, it might take up to 24 hours to get some of these benefits. But you can research more of that on your own. All right, fermented foods and gut health. Once again, this is an emerging field. There's some science on it. Foods produced or preserved by the action of microorganisms, that's your fermented foods. Probiotics have been associated with improvements in digestion, immunity, and weight loss. A large majority of the immune system actually resides in our GI tract. So when gut health is imbalanced, it's hard for the body's immune system to function properly. Another interesting fact, 90% of the body's serotonin is made in the digestive tract. So your gut health can actually influence your mind and your overall mental health. It can't be pasteurized. Pasteurized would kill any of the beneficial microbes. Examples of this, kefir, tempeh, natto, miso, all made from soy. You got kimchi and sauerkraut from cabbage. You got kombucha, yogurt and cheese from dairy, pickled veggies, and sourdough bread are just some examples of fermented foods. Also, along with this, it can make things more bioavailable, so that's also cool. All right, tips. I'm just going to throw all my last tips here. So exercise and activity levels are a key part of this lifestyle equation. We all know that. So with that, you know, walking, hiking, taking stairs, all that kind of stuff, because we don't need to expend energy anymore to actually get our food. So we got to find creative ways to do that. Reduce and manage stress levels. Breathing exercises are great. Jesse showed that at his workshop the other day. Make sure you're getting adequate levels of sleep. Eat slowly. Be present with your meal. Chew it. Know what you're eating. Don't just shove it down your throat. Have an accountability partner. We're social creatures. So if you have a friend or maybe hire somebody, Cook your own meals, know what's going into your food. I think that's a real big thing with this, know what's going on there. Is there a healthier option? Slowly phase out processed foods with healthier alternatives. Too many restrictions at one time can cause binging. So this is a slow, incremental process. And of course, enjoy celebrations and gatherings. If you're being healthy most of the time, when you have those gatherings, just go crazy, have fun with it. You know, we're all gonna die, so let's have some fun while we're at it, all right? All right, and then finally, the cookies are always going to win the staring contest. So if you bring it in the house, you're gonna end up eating it, all right? So I think this is an awesome tip. If you wanna lower your daily caloric intake, look at your grocery habits and stop the junk food before it even enters the household. Because, for instance, I made homemade ice cream over the weekend. I've been eating ice cream every night since then. So there we go. Thank you very much.